Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, chiropractic, and medical-related information. I'm Dr. Adam Rodnick, a chiropractor out of Commerce Township, Michigan, and we're here with our co-host.
I'm Dr. Ruven Rubenstein out of Troy, Michigan.
And we're here with a very special guest today, Dr. Michael Kapsokavathis, make sure I said that right, out of Birmingham, Michigan. And he's the orthopedic spine surgeon with a really revolutionary new cutting-edge procedure that bringing to the United States that we'd love to talk with you about today.
Absolutely. I think it's a wonderful new treatment. It involves stem cells.
So tell us a little about this stem cell research. I know I've heard in the news that people like Kobe Bryant, he did it back in 2011, I believe. Alex Rodriguez, Rafael Nadal, big superstars, they've had to go across the country, I think to Germany, to get this procedure done, and now you're bringing it to America. So if you could tell our audience a little bit about it, we'd love to hear about it.
All of it revolves around stem cells. Different countries perform it in different ways. The government allows us to go do certain things. I certainly don't want to go to Tijuana to get some things done. There's some really great data. There's some really great new studies that are being done, and basically harvesting your own stem cells and using those stem cells to regrow tissue that's dying. From my perspective, the biggest target would be the intervertebral disc, the most common cause of low back pain and eventual cause of spinal stenosis, sciatica. So the ability to possibly catch the whole degenerative cascade that leads to limping, herniated discs, all of these problems that cripple people later on, the ability to possibly stop it in its tracks, stop it before it even starts, is enticing, and there's no way to not at least research it more and start offering it, considering that there's very few downsides to performing the procedure itself.
Incredible. And so obviously it's a lot less invasive, would you say, than traditional surgery that, most people think of a surgeon just for, you go in, as soon as you meet the surgeon, you're lying on the operating table, they're slicing it from head to toe. This would be a lot less invasive, is that correct?
Correct. I'm a minimally invasive spine surgeon, but I still desire to offer something that is different, conservative. This is a non-surgical approach to doing things. It is not fusion, it is not laminectomy, it is nothing like that. It is trying to regrow the tissues that eventually break down completely and end up in people needing surgery. So it just depends on where in the process they are. Hopefully we can catch them.
Now, is this a first line of defense, or is it something you do later on? Has the patient already gone through a series of other procedures, or is this they come in and they qualify for this procedure, so this is the first thing you'll do to that patient?
They do have to qualify. I wouldn't do this to somebody who's had a short period of back pain. They need to go through other conservative managements first. Chiropractic care. You guys are fantastic at taking care of people in the initial stages of injury, and most commonly you guys carry them through the initial stages and you're able to get rid of their pain. But there are people that have structural problems, chemical disease. There are issues that, despite your best efforts, they just don't get better. It's slim. You guys are able to take care of most people. Physical therapy, anti-inflammatories, a lot of the hallmarks of what people know to do themselves, they have to try that first. This is minimally invasive, this is non-surgical, but at the same time, there is some sweat off your back to get this done, and I don't recommend it for people who've had an immediate episode of back pain. You should be suffering for a while before you consider transplanting some stem cells.
Yeah.
So.
And one thing we like to do is to co-manage patients with someone like yourself, that as we're working with someone, we want to see how they're progressing, how they're getting better, and if we do start to see plateaus, we feel great that we can trust someone like yourself to send our patients to consult with you. You may tell them just continue to see us, hold off, we're going to keep looking at something, or you may say, now it's time maybe that we'd like to do a procedure. So
absolutely.
That's another misconception that a lot of people may have, is that when you see one type of specialist, you kind of have to try this or try that. And there's no reason why we can't communicate, work with each other, and co-manage.
It's the sign of somebody who doesn't fully understand what's going on with the spine if they're not willing to utilize other experts in the field, because quite frankly, I love doing what I do for a living, but there's a lot of damage that I do, in order to try and get things right for traditional spine surgery. It's hard on people, and it should honestly be used as a last resort unless there's already horrific damage happening to the spine that we have to stop. It should be a last resort, and in which case you need to reach out. And some people come to me and they're not a great surgical candidate. They're going to go right back to you guys. You guys are the front line, and you guys do a fantastic job of helping take care of these people.
So I'll just let you know that we really appreciate that you're letting the audience know that chiropractic should be the front line, that we can manage these patients together. And a lot of chiropractors, they think they know it all and they may not refer. I know the last generation, we would never have had a conversation with an orthopedic spine surgeon and chiropractor
and
together.
surgeons or medical doctors can't get along, and that's not the case at all. It's very
No.
You could have put up like a boxing ring and had it film it like that, but it
Yeah.
probably wouldn't have gone as a peaceful conversation.
So it's real nice to let the audience know that we can manage these patients together if we put the patient first. If we think about the actual patient and the results that they're going to get, take ourselves out of it and say, okay, what can we do to get them better? Co-managing is obviously the best way to do that.
I agree.
We don't need to say one side or that we have the glory or they have the glory. There's some people we can work with. They may have fairly good results but reach a plateau, and then we send it to you, and they have a minor procedure done, and then you send them back to us. There's no reason why patients can't go back and forth, as patient advocates to do the best thing for the patient.
I don't want glory. I'm sure
exactly.
you guys don't want glory. What I want is for the patient to tell me, thank you, I feel better.
Yeah.
Exactly.
And that could be, thank you for sending me
Exactly.
you guys.
I get the same thing.
Thank you for
Wow, the
sending
doctor
me.
you sent me to, he was really
Right.
great, and that's for you to talk with us, and we'll communicate as well.
That's a sign of
Very
recovery, and that's the goal that we all have for our patients if you care for them. So.
So just explain a minute to our studio audience here. When you talked about the intervertebral discs, what exactly they are, what their purpose is, why we have them, and then most importantly, what we can do, what you can do surgically, what we can do with chiropractic, and how we can keep these discs healthy.
Sure. Let's start with the healthy one.
Sure. Got the bad one over here.
This is what you hope your disc looked like. Bone, disc in between. It's a joint. It has to be highly functional, and it's based in cartilage like all joints are based in. The problem comes, and we don't fully understand where the problem comes. It's a complex set of genetic happenings, and you can blame your mother for this. And damage, that hit that you got in football, that twisting injury in volleyball, all of these things end up damaging the disc. And I focus on the disc because it just seems that the cascade of problems does tend to begin in the disc. So the first thing that people tend to start out with is not a herniated disc, and they show up in your office with back shooting, terrible leg pain. That's usually further down the line of degeneration of the disc. What usually starts is some drying out of the discs, some, you use the word fissuring or cracking of the supportive ring of cartilage around the outside of it. The inside is supposed to be nice and jelly-like, like a jelly donut, and the outside is supposed to be a bit more firm, like the outer wall of a tire. We start seeing chemical changes in the very inside, and it's a slow process that usually happens over the course of decades. There is living tissue in here, and that's the problem that we're seeing, is the quietly dying living tissue stops making the supportive cartilage, and the stem cell therapy is guided at supporting what's left if it's alive, and that's why we see better results if that disc is not completely dead. If there is a disc that looks like that, completely dead, there's less of a chance of getting great results from this. The better results are seen in people who have less severe MRI changes, but they still have symptoms relatable to the disc and MRI changes. Those are people that are candidates for the stem cell injection directly into the disc itself.
And I really like what you said in the way you explained to the audience that, by the time someone has the herniated disc or the bulging disc or something's radiating down in their leg, they've probably had instability for a long time, and use the old analogy, the straw that breaks the camel's back. They've had weakness there, they've had instability, the joint is not fully functional, and now they're more susceptible to a bigger injury or the bulge or the herniation. And so a lot of people think when they start having back pain, they now start to have a problem. But by the time they have the pain, most of the time the problem has been building up for a long time, even years, to get to the point where they now feel it as significantly with that much degeneration. I mean, we see even people in their 20s and 30s that are starting to have, some osteophytic formation and degenerative osteophytic or spondylosis changes here, even younger than most people would imagine. We see, if I asked anybody what age you think someone would start to see signs of bone spurring, they may say 70, 60 years old, but we see it in young people. Again, it could be congenital anomalies, congenital abnormalities, but trauma, bad posture, the things that they do in their daily life are causing undue wear and tear. I kind of like to use the analogy sometimes, like if you look at a set of door hinges. The spine, it's a set of joints all the way up and down, and if you just took one door hinge and smashed it with a hammer, then opened it 10,000 times, the one you smash is probably going to rust first. So it's more likely that if there's decrease in motion, we're losing a natural process called imbibition that helps the body have a natural pumping motion that gets minerals and fluid and vitamins into the disc. We're not getting the normal amount of motion, so over time that disc could have more of a chance to rust faster, degenerate faster. And as that happens, eventually symptoms show up. Now there's more instability and more likely to have a bigger injury down the road as well.
So tell me, the stem cell therapy, what's the procedure of getting the stem cells into the patient? I know we spoke earlier that I believe it's an injection. Is that correct?
Correct.
Can you show the audience how the injection is given and how minimally invasive it actually is?
Sure. The first part of the procedure is getting the cells themselves. Most people have heard of a bone marrow biopsy. The bone marrow biopsy in general involves taking a core chunk of your bone. It can be a bit more painful. We try to avoid that. That's not normally how we do it. It's more of you do poke into the bone.
You usually use the femur, correct?
No, I use the back of the hip, right there. It is different from somebody who had bone graft taken from their hip for a spine fusion or other type of fusion. That involves cutting out a slice of your hip, exceedingly painful. I don't do that anymore for spine surgeries. This is a small poke hole. You numb it up first, and then a needle in, and you draw out bone marrow. There's some specifics to the technique, but overall, the goal is to get not blood. We can take venous blood from a vein, that's easy, but to get those living stem cells that have the capability of becoming something else. Another way to do it would be to take fat, usually a little nick right there. This is not liposuction. You're not going to look like $1 million, but and then taking a wand across and pulling some fat cells out. The goal is still, from those different populations of cells, isolate the cells that have the possibility of becoming what we want them to be, which is not unhealthy cells in the disc, but healthy, vibrant, producing cartilage types of cells in the disc, in the facets, in Kobe Bryant's knee. I forget what A-Rod had, exactly where he had it done. Rafael Nadal had it done in his back. But the whole goal is transplantation of those cells into the area that needs it. It's an injection. There's no way around that. At the same time, we're more than willing to give you some sleepy medication if you need to go through with it, but overall most people get through it with zero medication because we're gentle about it. We use some numbing medication.
But it's a real specific injection. You're using fluoroscopy, video fluoroscopy, to make sure that the injection is going exactly where it needs to be. You're not guessing at all. There's no guesswork with this injection. I know some people, they give injections and they're poking and prying, hoping that the injection gets to where it goes. With this procedure you're putting on, you're using the video fluoroscopy to make sure it's perfect. Is that correct?
Correct. There is a 1 centimeter.
Just stabbing it in there.
No, it's not close your eyes and throw a dart. I have an area about the size of a dime that I need to get this in, and it's in a very specific area and it's very deep within your body. Don't just trust somebody who says, oh, I've done a couple. I'm a spine surgeon. I'm a minimally invasive spine surgeon, which means I'm very well versed in radiographic anatomy and how to get something where I need to get it in a disc, in a spine, anywhere. And so it's I suppose you could call it a sniper shot. There's a small window that you have, and you numb the skin up, one needle, second needle, and you place it pretty much center within that disc where the jelly is supposed to be, the nucleus pulposus. You deposit the stem cells right there. You deposit them very soon after you take them. There's different techniques. Overall, I don't want to mess with the cells. I simply want to isolate the cells. I don't want to heat them up, expose them to other chemicals. This is your body. These are your cells. I want them completely fresh and then placing them exactly where they go there. At that point, there's usually some discomfort from the hip and the needle, but it's not bad. It might be a couple pain tablets over the next few days, if that. At that point, I would turn them over to you guys to effectively try and increase the blood flow to the end plates, because that's what feeds the disc. The disc has no blood flow to it, or terrible blood flow to it. And so I would start turning it over to conservative care and lifestyle management, and basically try and support the stem cells grow. And it's perfect to turn them over to you guys again and basically have you manage them, probably a set of decompression over a couple months to do everything you can to support.
Yeah.
We're seeing pretty good results fairly quickly. Technically, the numbers are anywhere from 60 to 70% reduction in your pain, which is huge.
Yeah.
Especially considering these are people that have failed this, failed that, failed everything, and they're staring down the barrel of a spinal fusion.
Yeah.
And that has, in reality, depends on how honest you are with yourself, I'd be happy with a 60 to 70% pain reduction in all of these people. I would be happy with that. So the fact that you can achieve that fairly consistently, no promises, please, this is brand new science.
Yeah.
There's studies going, we're enrolling patients.
And again, what's so cutting edge is how minimally invasive it is. It's not,
Absolutely.
There's no cutting open, there's no rods, there's no screws. It's,
nothing like that.
It's more minimally invasive, so it's, not nearly the risk, or for someone to give that a go, it's not like they can't go back on it.
It is relatively low risk.
Yeah.
It's as much risk as a epidural injection, I suppose you could say. There's no steroid being injected when we do this. There's risks associated with steroid, but it's pretty benign in all honesty.
And they're using their own stem cells. They're not taking it from somebody else. You're
No.
taking it from them, putting it back in them where it needs to be.
Correct.
So that's what I love about this procedure. How many people in America are doing this? I know you're one of these bringing it here, but how many people are studying this right now?
There is a fairly good-sized study happening in Colorado. There are pockets, but overall, it's very rare and hard to find.
So we're lucky enough to have you
one
on the
right
show,
here in our
talking
backyard in
right
Michigan.
here on our show, having one of the few doctors in America actually performing this procedure.
In the world.
And in the world performing this procedure. And we're happy to have you as our guest. And we hope that you get the Kobe Bryants and the Alex Rodriguez's, and that you can change these people's lives. I mean, 60, 70% pain relief is huge. If people have been living with this stuff and they say they've tried everything, I love hearing that people say, I've tried everything. Well, now there's something we can add to that tool bag.
They haven't tried this.
They haven't tried this.
No, it's far, far too rare for somebody to say that they've tried this. There's nobody out there besides random people that happened just fly to Germany.
Yeah. One thing you mentioned is, so with this procedure, once the disc is dead and gone, it's a lot less likely to be successful. Is that correct?
Correct. We haven't identified the point of no return.
Sure.
That's all I can say. We have identified that, I forget the exact number, but there's a healthy chunk of these discs that their MRIs are starting to reverse. And even at 2 years out, they're maintaining that reverse. So it's going from that black disc back towards the white fluffy disc, which is amazing. There is really nothing like that.
So with that being said, I really want to encourage our studio audience that to get checked out, don't wait till it's so bad or it's been there chronically before we take care of ourselves. We see a lot of people come to our office that have had years and years of chronic pain, haven't really done much of anything, take over-the-counter prescription medication, and have never seen an orthopedic surgeon for an opinion, a chiropractor for an opinion, a specialist at all, just living on just pain medication. So we really want to encourage people, the earlier we catch something, the better. So get a checkup, get an evaluation, again, whether it's neurosurgeon, orthopedic surgeon, chiropractor, someone who specializes in dealing with joints, the spine, don't wait until it gets so bad where there isn't a point of no return, or until some of it is irreversible damage. The earlier we catch it, absolutely the better it is. The earlier we keep a joint healthy is better than being reactive.
And what I like to tell people is, don't wait till you're in pain. Let's do preventative measures. America thinks that pain is normal. America thinks that you have to be in pain to go reach out to a physician or a chiropractor or a doctor. I've been telling a lot of people, you didn't wait to get a cavity in your teeth to start brushing them, all right? As soon as you got teeth when you're a few years old, you get teeth, you start brushing them at a young age every single day, sometimes twice a day, to prevent cavities and tooth decay. So why are you going to wait till you're in pain to brush your spine? That's what I tell them. And they go, oh, I never thought of it that way. I go, yeah, because you in their mind and they have the misconception that you need a symptom to seek care. But preventative care, walking into my office or walking into your office, is way better than crawling in or being pushed in a wheelchair. So if we can prevent people from ever needing these things, just from getting under care from life, showing them exercises, proper nutrition, like you said earlier, these things can help people change their lives from the moment they're born. Let's keep the whole world out of pain. Would you agree, Doc?
Absolutely. Like I said, you guys are the front line. I get people after they've failed a lot of things, and every now and then somebody comes in, and it's been 10 years with very high level pain. They can't hold their foot up when they walk. They can't sleep. They've lost their job. I can help.
Yeah.
But sometimes there's just something to be said about tackling something head on and not putting it off and getting in front of it. And preventative medicine is, the reason the insurance companies get behind it is because it works.
Yeah.
Right.
And it keeps everybody's costs low. And that goes all the way down to taking care of your spine, not being overweight, not smoking, seeing your chiropractor. It's reasonable and good for your body to maintain alignment, maintain strength, and it's just maintain homeostasis.
A lot of people think that insurances may not cover our type of care, but Medicare, even as a government program, just as the government realizes that chiropractic saves them a lot of money over time.
Yeah.
So they.
The spine is the
Definitely
foundation of your body. If the foundation is off of your body, think about your home, the windows start creaking, the floors start creaking, the walls start cracking. So we want to make sure that we maintain the foundation of your body, which is your spine and your nervous system, so that all functions work properly. If we can continue to make sure that you not just feel better, but you actually heal better by maintaining a healthy nervous system, you can live a happy lifestyle. And that's what it's all about. It's about giving people their lives back.
You could bring that all the way down to I'm sorry, your corollary was amazing because you guys commonly work on the lymphatic system, which is the drain. And if you can drain away from the foundation of the house properly, the foundation usually stays strong and doesn't suffer damage. So I usually get called in when the foundation is destroyed. And that's quite a job to take care of. I love what I do, but at the same time, if you can manage drainage.
And the thing is, like you said, we love to be preventative, and I like to tell people, use that same analogy. Think of us like a dentist for the spine. You go to a dentist not just when you have a toothache or cavity, you go for maintenance as well to keep it clean. So we encourage people to come see us, be proactive rather than reactive. A lot of times people wait too long to come see us, and then a lot of times people in our position may wait too long to send to someone like you. So that's why it's really important for us to be proactive, see people, to keep a healthy spine, but when it's time to send out, I'll be the first one to tell someone, we'll send you to Dr. Michael over here because we think we may need a little bit more. And we can still keep seeing them, we can still keep taking care of them, but there's a right time for them to get checked out, and there's also a right time for us to send them around the chain, You
have to always apply the test of what would you do for your little sister. And that's not always pretend that you know everything that's going on, and seek help, seek a second opinion. And I'm happy with just the communication that you guys have with me about our mutual patients. It's a thing of beauty when it happens together like that.
Absolutely. Can you tell the audience where they can, do you have a website that they can go and find out more information about you?
Yes, drkapso.com, drkapso.com. My office is in Birmingham, central within the metro area. I operate mostly out of the Henry Ford Health System for larger cases that need hospitalization. But I do a fair amount of the surgery outpatient, considering a lot of it is done minimally invasive. And so we can do it in a surgery center. There's lots of different ways to get it done. Usually as minimal as possible. It's rare that people have to have those big reconstructions, rods and screws, all of that. It's relatively rare that those have to be done like that, and I even very seldom describe them to people as, you need this.
Yeah.
It really is their choice. I describe an option to them. They might not like the option, but considering what they've tried up until that point, a lot of times that's what they're faced with. Continue what they're doing or try something new. And that is what it is. We have a conversation.
And I really like what you said, too, about just opinions. You know, it never hurts to get a second opinion. People get a quote on the roof, they're going to get 3-4 quotes on the roof. People get a quote on full reconstruction of their spine, they see one guy, they take it as the word of God. Right.
Yeah, no.
Doesn't hurt to see a second person to you know, get a few opinions on it before they jump into such a big procedure.
You have to find what is middle ground to you. Everybody is different, and some people, that's what they want. And some people, it's the opposite of what they want. And polling the crowd and finding different doctors to give you a different opinion is how you do that.
I like how you do that too. That's kind of what my goal is for our patients. And my goal is to support them with what their goals are. You know, if they just want to come to see me every once in a while just for, you know, pain management, we're here for that. If they want to come and see me really regularly for chiropractic corrective care, we're going to see more structural and functional changes in the spine on x-ray and in the nervous system, we're here for that. So I want to know what their goals are so that I can best support them with it. And it sounds like that's what you do on a different type of scale, you know.
It's a different scale, but yes, absolutely.
I want to always get what's best for the patient. That's what it's all about.
Right. And I'm not the best at conservative care. I will freely admit to that. My training is high-speed burrs, knives, rods, screws, needles. So when it comes to people who what's best for them is not injections, surgery, I freely punt to whether that's physiatry, chiropractic, family medicine, psychiatry every now and then. I mean, just you have to get to the root of the problem and find who is best fit to fix that problem. And it's not always me. I'll be glad to help, and if I can't, then I point them in the right direction.
And it's nice to know because you're a trained DO, correct?
Correct.
So you had the training for spinal manipulation, and you said, okay, you had the training, but the chiropractors are the experts, and that's why you like to refer to us, because you understand the structures of the spine because that's what your training was in.
Correct. I did a lot of it. People called me the guru of the class, but I made a decision to focus my mind and my time and my talents elsewhere, and I remember it fondly, but it's just not what I do anymore. And there's people that what I do for a living is not up their alley. There's far more people that what's right for them is what's up your alley, and so be it. It is what it is. I love what I do for a living, and I love what I do for a living simply because I take care of people who need it and not just needlessly see people and needlessly operate. So,
thank you for joining us today, Doc.
We
That's all the time we have
on the show.
So we're here. This is again Dr. Michael Kapsokavasthis out of Birmingham, Orthopedic Spine Surgeon, and I'm Dr. Adam Rodnick out of Commerce Township, Michigan, chiropractor.
And
here with our co-host
Ruben Rubenstein out of Troy, Michigan.
And we will see you guys next time on Ask the Chiropractor.